Hello, I'm Dr. Michael Karlfeldt. Sono-Photodynamic Therapy is a very, very powerful therapy that utilizes a photosensitizer that you can introduce orally, intravenously, or you can inject it locally into the area that you want to treat. The photosensitizer essentially pulls light at a much higher concentration to the location where it's at, so that you can then trigger oxidation of that tissue. And obviously, when you deal with cancer, you want a strong oxidative effect on specific tissue, and you want that to be targeted. The photosensitizer that we use the most, that is the most powerful, it is the most pricey one as well, but it is well worth it, especially when you battle cancer. It's a non-ionized version of ICG, or iodine cyanide green. A good friend of mine at a German university created it, and it is really powerful in how it's able then to get into the tumor tissue. They've actually done biopsy just after a few hours to see how much that is in the tumor tissue, and to see that there's a good concentration of that photosensitizer already there. The key is that you do the photosensitizer. The ice nano version of ICG is the most powerful one. There are other ones that you can use. Methylene blue is a common one. Riboflavin, believe it or not, vitamin B2, which is riboflavin, is another photosensitizer. But then you have weaker ones like curcumin, poly-MVA, vitamin C. All of them have a little bit of a photosensitizing effect, and not as powerful and not as strong as the ICG version or methylene blue. The key with photosensitizer is that as it's pulling that concentrated light to the tissue, you want to be able to match then the color with the photosensitizer. So, like for instance, the ICG, the color that matches, that activates the ICG is infrared. You want to do infrared. And the beauty with infrared is that it has the deepest penetration. So let's say you inject the tumor, like a breast tumor or prostate tumor or colorectal, or something that you have access to, or a lymph node. You inject that with a photosensitizer. It becomes very concentrated, doesn't go in all the other places. It prefers tumor tissue to normal tissue about 50-1 from what they've seen. Then use an infrared. You can then bring the needle into the tumor and then irradiate the tumor from internally. So that means that you have a very high and strong concentration of the light. You can do it externally. It's like a shower head that we use. And then we use strong laser with the infrared. It has a deep penetration, so it can kind of hit that tumor at a deeper level and really create a lot of oxidation within that tumor tissue. Prostate, use a catheter. You can bring the optic cable up towards the prostate, and then you will irradiate that with the laser light infrared. Let's say you would do methylene blue. You do that intravenously. Methylene blue is not as expensive. It doesn't accumulate as strongly in the tumor tissue, still accumulates well. It has a lot of other benefits as well. I mean, it's turn on mitochondria. It is great as an antiviral. It also helps with how you feel emotionally. It helps to kind of boost the serotonin levels. So it has a lot of other aspects to it, that just by itself, it's beneficial. But by combining that also with a intravenous or external laser light, you can then also trigger that oxidation of pathogens, viruses, bacteria, fungus, spirochetes, etc. You can then inject then methylene blue internally as well into the location. You can do it intravenously, or you can take it orally. So methylene blue, we have oral pills that you can take, and that tends to kind of build up the levels in the body as well. Obviously, intravenously, higher concentration. Interstitially, then you have a much higher concentration in the location that you want to treat, and then you would use red laser in that location to trigger that oxidation, because the methylene blue matches with red. Riboflavin intravenously, and then you match that with blue light itself. Is very, very antibacterial. The riboflavin will attach itself then to the pathogen, and then you use the blue light, and then that increases then the concentration of the light onto that pathogen to oxidize it, to kill it. So that's a beauty using photosensitizers in combination with laser light. We bring the ultrasound, and the beauty with sound waves is that it can penetrate even deeper. You can then combine the photosensitizer, the light, and then you can bring sound to it as well. What they've seen is that the sound actually triggers production of cavitation bubbles within tumor cells, within cancer cells, to cause them to explode, literally cause them to die. So that's the beauty of the Sono-Photodynamic Therapy combination of a photosensitizer, and then you bring in light, sound to trigger the oxidation of it. And you do need another component that's really important in regards to the photosonodynamic therapy is that you need some kind of oxygen therapy along with it. So you can do a Hockett, which is something we do here, hyperbaric. You can do intravenous ozone. We can inject the location with ozone. There are a number of different tools that we utilize, but you need oxygen there in order for a good level of oxidation to take place.